Okay, so we're doing a dental today on Molly. This is Molly. I'm going to show you guys her teeth real quick. So Molly is 7 years old. She's got quite a bit of tartar buildup on these teeth. So we are going to be removing all that today for her to make her have a pretty smile. And Dr. Pribble has already done his pre-anesthetic exam. She's already been pre-medded to kind of take the edge off. So now we're going to give her induction agents, place her endotracheal tube, start her on anesthesia, and get started with radiographs. Okay. Come here, Molly. Kiss your leg. Oh, good girl. Our induction agents go in the vein. Alright. So now it takes just a few minutes for her to get sleepy, for those to take effect, so we can go ahead and place her tube. Good girl. Okay. And there's a couple different ways to measure which tube is going to be right for your patient. A lot of times I will kind of measure in between the nostrils there with the tube. Your tube should kind of fit right in the middle there. And then we'll kind of hold the head up, and you can measure to the thoracic inlet to know about how much of your tube is going to be hanging out, so you know how far to get in. Okay. And you open the mouth and pull the tongue. You're okay. Good girl. And the trachea. I know. And then you tie your tie on. Alright. And then she's intubated. So Molly is now intubated. She's on her gas anesthesia. So now we're going to take some dental x-rays. This is our x-ray unit. This is the plate. So the plate goes just right in her mouth. And the reason we do dental x-rays is to basically see what we can't see below the gum line. So we're looking for any diseased roots, any abscesses, anything like that. And we'll be able to see them on radiographs. And they're digital, so once we take them, they pop up on our computer over here. And we will get every single tooth on radiographs. And once we're done with this, we can move to the next step of the dental, which is to debulk all that tartar off of there. And that's what they come up like. Okay, so all of our radiographs are taken. So now we're going to start the next process of the dental. We're going to finally start to crack some of this tartar off. So you just kind of get in here where there's a big chunk of tartar, and you kind of get this instrument around that tartar and just pinch, and it cracks off nice like that.
That was a big chunk.
There's going to be some bleeding. Her gums are very inflamed, so that's to be expected. And so we're going to go through around all her teeth and just crack that off. That way we can use our ultrasonic scaler to get the remaining pieces off. Alright, so now that I've debulked for the most part, I'm going to go ahead with my ultrasonic scaler and get those fine pieces off. So this is like what human dentists use to clean your teeth, only you don't get sedated. You open your mouth all nice for them. Dogs don't typically do that for us, so same concept here. This scaler kind of puts out some water to help the tooth from heating up. We don't want it to get all hot. And so I'll use this scaler on all teeth to get all that fine tartar off and make them nice and shiny.
Okay, so this patient, I'm doing my oral exam on this patient. We have a number of bad teeth in here. Looking at the radiographs and also just doing a physical exam on the teeth, we have several that are going to need extracting. These incisors are very loose and are held in by almost no bone. And so even cleaning these up won't do any good. They will just remain diseased and painful in the mouth. So we're going to remove those today, and then we're going to polish the rest of the teeth and make this mouth clean and healthy. So I need my instruments, please. I'll need both sets, wing and gray handled elevator, and my extractor. Extractor's here on the table already.
Oh, you got them already?
Yeah, I got it. I got it.
Oh, you got it? Okay.
Okay, we're going to start with some of these incisors, removing those.
You think you'll need to?
And we'll elevate around those teeth. Okay, so after elevating some of these incisors, we're going to go ahead and remove them.
There's one.
So we've removed 401, 402, 403, 301, 302, and 303.
We've finished scaling off all that tartar, and now our teeth look all pretty and shiny. So basically the final step of this dental is to polish everything and just hopefully prevent the tartar from coming back as quickly. So we just put some polish on this little end here and just make sure we do every surface of every tooth that's left. And then once I'm done with this, I'll go back through and just kind of do a quick rinse to get the excess polish out of her mouth, and then we will wake her up.
I'm gonna go. Alrighty, now that she's done with her dental, one thing that we like to do, just as a courtesy, free of charge, we like to express the anal glands and do a nail trim on them. As you can see, her nails are pretty long, so I'm gonna just take care of those for her. I'm pretty sure this will help her walk better too. And just beware, the nails do fly sometimes, so hope you can duck and dodge real well. The dew claws are always the hardest to get. There we go. Those look good. And then we will express her anal glands before she wakes up.
So we're finished with the dental procedure now. We have extracted a number of teeth, but now, as you can see, we have a number of teeth left, and they're all very cleaned, and they've been polished, and hopefully this mouth will be healthy now. The patient's going to be on antibiotics for about 10 days to help the gingiva heal. She's also on some pain medication. She'll be on that for a few days also, so that she'll be comfortable during her healing process. And after we get her recovered, after she's awake enough, then we will be removing the endotracheal tube, and then we will recover her the rest of the way, and monitoring her temperature and how she is doing throughout recovery. Then she'll be ready to go home later on this afternoon.